An autopsy reveals American Idol alum Mandisa died due to complications with obesity.
We are joined this morning by Sharp Resealy, Dr. Corinne Yarbrough. Doctor, good morning. Thanks for being here.
Good morning. Thank you for having me.
When you hear first of all, just such a sad story about what happened to Mandisa, especially for Idol fans, but when you hear something like complications from obesity, what does that mean? Because I know obesity leads to so many health issues. So what does that mean exactly?
You're exactly right. And I would say, I think she died when she was 47, which is very young, even for somebody who has obesity. So it can mean a number of different things. Number one, first and foremost, is heart disease. So I would guess it had something to do with her heart. That would be my number one guess.
In terms of when you say heart, because again, I don't want to say we've become numb to hearing these terms on TV over and over, complications from obesity, heart disease, this, that.
Yeah.
Can you give me any specific detail? When there is obesity, talking about 100, 200 pounds over what would be considered a healthy weight, what does that do to your heart, to your blood vessels, to your overall body?
There are quite a few things. In fact, there are over 230 complications that can occur from obesity. Those comorbidities is what that's called. And so one thing, you can have plaque buildup in the arteries of the heart, which impedes the blood flow. Hypertensive heart disease, so that's if somebody has high blood pressure in addition, that can cause the heart to have to work harder, and then you have thickened muscle. You think, oh, thick muscle, more muscle in the heart is good. No, it is not good. In fact, it impedes the heart's ability to pump properly.
I know sometimes, like he just mentioned, we think of heart disease, we think of like type 2 diabetes. What are some of the other diseases that we need to essentially look out for?
So a lot of people don't know this. There are a number of different cancers also that are associated with obesity, like liver cancer, kidney cancer, colon cancer, endometrial cancer, which is the uterus, breast cancer, prostate cancer. I could keep going. There are quite a few. Yeah.
Oh, wow.
It's incredible when you start talking about, we talk to so many doctors, how everything is really just connected, isn't it? You do one thing, it affects the other, and everything. It's the human body. Let's talk about the mental health and depression and how that plays a role in obesity, and maybe it's a genetic thing. What happens in most of the patients you see in terms of how they get to the, because what was shocking to me is that during the autopsy, it was revealed that she weighed almost 500 pounds.
Oh, wow. I didn't know that.
Obviously, that's a body can't take that kind of weight.
Yeah. Well, with regards to mental health, a lot of patients I see kind of get into something of a shame spiral where they want to lose weight, they're trying and not succeeding, and their self-esteem can be really bad. A lot of people are having like, that you feel worse, so then you want to comfort yourself, and if your stress relief is eating, well, that can actually worsen the condition.
Well, can we go back to that? Because like you mentioned, some people will do the best that they can to try to lose weight, and so I think people think, well, I'm just going to exercise.
Yeah.
But they're still eating perhaps the same things or the same amount, and so just because someone who is obese and is exercising doesn't necessarily mean that that's helping.
It probably helps. I mean, it does help some.
Okay.
But you're right. That's not the full picture. In patients who are exercising regularly, who have normal blood pressure, who do not have diabetes, who do not have, other diseases like high cholesterol that we know of that are associated with obesity, but they still have obesity, those patients still have a higher mortality than the general population. So there's still a health impact.
Yeah, we're living in a time now, doctor, as you know, it's like weight loss drugs have taken over everything.
Yeah.
In terms of helping those who are extremely obese, will these drugs, are they healthy for them? Are they good in terms of reducing the risk? Or where are we now in terms of how doctors are seeing this with the Ozempics and everything else?
Well, I can speak to my opinion, which is I am really excited. I am expecting that our mortality is going to go down significantly with these medications.
Really?
We have a big, trouble getting them for a lot of people who would qualify and should be able to have access to them. But yeah, I'm absolutely seeing a huge drop in a person's weight when they've failed in other arenas. These medications work so well. I had one patient say it's like having freedom, because that part of the brain that's telling them, oh, constantly I need to eat, I'm hungry, I need to eat, you're thinking about those donuts in the other room, that part of the brain is just quiet. and that's and they're so I'm excited.
So it certainly helps,
Yeah.
but there needs to be some type of lifestyle change, I imagine.
Oh, for sure.
Yeah,
Yeah, I would
yeah.
still recommend, of course, diet and exercise. This is for patients who failed with their attempts with lifestyle choice.
Yeah, I think people hear again diet and exercise. Like I think if we explain it and,
Yeah.
and kind of subtle changes that are sustainable in your life, not I'm going to suddenly go for a month and drink only water and eat
Yeah,
almonds.
no.
That doesn't work because then you'll go right back.
Exactly. I am not a fan of these fad extreme
Right.
diets because what I see over and over again, patient loses weight on the fad crazy diet, and then once they're off the diet, the weight just comes right back.
Yeah.
And so we're actually seeing obesity in a different way, more like a chronic illness. And that's why when we start someone on medications or a diet, the idea is stay on it. If you have weight loss, you have success on that diet,
Yep.
stay on it.
Stay on it. Oh.
Yeah, don't do it for 3 months to lose weight. You look good in a few pictures and then bring
Right.
it back where you
Sure,
started.
sure.
That's actually worse for you to go up
Exactly.
and down than
Right.
to stay steady.
The sustainability of something that you can't torture your body to the point where you can't. And then the older you get, anyway, we could talk about this for hours.
And it gets harder and harder to lose weight as we get
Yes.
older.
Dr. Corinne Yarborough with Sharp Sealy, thank you so much for the insight. We
Yeah.
appreciate
Thank
having you
you.
here.
Thank you for having me.